A baby boy, just 10 minutes old. Although his breathing is strained, he's alive and well. That may not have been the case if his mother had not been brought here, to a new hospital in one of Rwanda's most remote districts. In fact, he's the very first baby born here. While his mother was in labor, he'd shown signs of respiratory distress, a major problem if the delivery had taken place at home or in a rural health center. Instead, mother and unborn baby were brought here, where trained staff and quality equipment ensured their safety. One of Rwanda's top health officials says the new facility is a major step for a country with a high maternal mortality rate.
There are too many deaths that we could prevent by increasing access to care in a geographic way, and also in increasing the expertise of health professionals that deliver services, but also the number of health professionals.
This is what the Butaro Hospital is here for, to provide quality health care that has been lacking in Burera District, which just a few years ago had only one doctor for its 340,000 people. Built on top of a hill with views of Rwanda's lush valleys, it's a beacon of hope in a country with many scars. But the government couldn't have done it without the help of others. The US-based nonprofit Partners in Health, which has built hospitals and clinics throughout the developing world, provided expertise and paid more than $4 million for the construction. The Clinton Foundation has also provided support, while the government covered the cost of the hospital equipment. Dr. Peter Drobak is the country director for Partners in Health.
And I think it really represents the way partnerships, public-private partnerships for development should work. We're here to help to support the government implement their roadmap and do it effectively, and they give us the space to try new things and to innovate.
The innovation includes effective but inexpensive design features that can be replicated across the developing world. People gather in the open air instead of confined corridors where diseases like TB can spread. In the wards, every detail from the smooth resin on the floor that is easily sterilized to the type of ceiling has been carefully considered.
Number one, the ceilings are high and vaulted, and at the upper level there are these non-operable louvered windows, and that allows air to pass up and out. It's something called stack effect ventilation. Heat rises naturally, and so the air moves up and it's continuously passing out. That's driven by these very, very large fans, which are low velocity, high volume fans. What they do is, without creating much of a draft, they move a lot of air because they're enormous, and they help to accentuate that passive ventilation up and out.
There are also ultraviolet lights that kill TB bacteria and other microbes in the air.
So those things collectively can actually achieve the same degree of ventilation and infection control as we do in United States hospitals at a far lower cost.
And cost is key in a country like Rwanda, which is still recovering from the 1994 genocide that left an estimated 800,000 people dead. In order to heal and develop a better health system, the government is implementing a pyramid-based structure with the district hospital at the top. At the base level, every village has at least 2 community health workers. They're the first link in a chain that connects the villages with the health centers and the centers with the hospital. Home visits with HIV-positive patients like this one are handled by the community worker. They're trusted members of the village with rudimentary training to monitor those on medication and spot possible cases of common conditions like tuberculosis, malaria, and malnutrition. If there's a serious case that cannot be treated at the community level, the patient is referred to the hospital. The strategy is having a major impact in a critical area, maternal health. Until recently, most women in Rwanda gave birth at home with no trained health providers on hand. In too many cases, a complication resulted in the death of the baby and sometimes the mother as well. Now, the community workers encourage women to give birth in the nearest health center, which has trained staff who can handle routine deliveries. If there's a problem, they send the patient to the hospital. This strategy has drastically reduced maternal mortality in a country with one of the worst records in the world.
A couple of years ago, we had 8 deaths a day in Rwanda. And now we are at less than 1 death a day. Even it's too much, huh? But that means there is progress. But we should reach the point where we have 0 deaths that we can prevent.
Had it not been for the new procedures, these identical quadruplets would probably not be alive today. Now 16 months old and healthy, they are, to the hospital's knowledge, the first quads delivered vaginally in Rwanda, where all the babies and the mothers survived. When Angelique Mukazigama was in labor, she thought she was just carrying twins. Fearing complications, she was taken to the temporary Butaro Hospital, which handled difficult cases while the new hospital was being built. Converted from an old health center, the facility was basic, but it had doctors and trained staff. After delivering the first 2 babies, they discovered there was a third. And then another surprise, not just for the mother, but for the doctor as well.
When I did the last examination, in order to deliver the placenta, I realized that there were 2 feet, 2 other feet. Then it was very exciting. We called all the authorities of the hospital, and finally the last one came, the 4th baby. Yeah, it was very exciting, and I think that it's one of my best days.
The days for the doctors and patients should get better still. Many jobs have been created and new skills learned in a community that built Butaro Hospital on a firm foundation. The outer walls are made of local volcanic rock, signifying renewal from a tempestuous past. Inside those walls, preparations are underway for the first cesarean section, all while the first baby born here lies peacefully nearby, oblivious to the people and machines that are keeping him warm and helping him breathe. But as he grows, his aspirations will be much like the Butaro Hospital itself, to breathe, walk, and run independently. For CNN, I'm Gary Streicher.